Hello everyone, and today I'm going to be talking to Marc Pacifico. So Marc is a good friend of mine. He's a bit younger, I think. He's a plastic surgeon, and he was an NHS consultant in East Grinstead, and he has his own clinic in East Grinstead called Purity Bridge. So hopefully Marc is going to join us. Many of you will know Marc. He's very well known in the aesthetics industry. He's on the Bath Council. Hi Marc.
Hi, Adrian.
How are you?
We're in Tunbridge Wells, so near East Grinstead.
Yeah.
But yeah, I was certainly a consultant there for 8 years.
Yeah. So tell us about Marc. So you were a consultant in East Grinstead. East Grinstead is, of course, famous, isn't it?
Yeah, it's a great place. It's just outside London, so it's almost halfway between London and Brighton. And for me, I lived in London all my life, and I certainly wanted to move out, bring up my family outside London. Hence, the plan was always to try and see if I could get a post out there, which I managed to do. So I live in Tunbridge Wells, and I practice both in Tunbridge Wells and in East Grinstead, as well as going elsewhere in Kent as well. But not back to London yet. Life's just far too busy to go back to London just yet.
Yeah. And why? I was at East Grinstead in 1996.
I hadn't yet qualified.
Yeah, yeah. Hadn't you really? And remind everyone why East Grinstead is so famous for plastic surgery, Marc.
So it's really revolves around Archibald McIndoe in the Second World War, and the really phenomenal, at the time, almost experimental, but life-changing surgery he did on the injured airmen, particularly the burns patients, the pilots, the RAF, and the famous guinea pig club came out of that. So they're so cool because they were human guinea pigs for Archibald McIndoe to try almost experimental techniques on that saved and changed these people's lives.
Yeah. And can you just talk us a little bit about your career? I know you became a consultant. In East Grinstead. What's happened since then, Marc?
Well, I was at medical school before then at Barts in London, St Bartholomew's Hospital. I did most of my training in London. I think we share the same fellowship in Australia, in Melbourne, actually.
Yeah, that's right. With Graham Southwick.
With Graham Southwick.
Yeah.
And subsequently, on return, I got my post at East Grinstead. I always had a parallel private practice and NHS practice. One of my, I think one of my frustrations, or one of my eye-opening moments was, I think in Australia actually, seeing how things could be done differently, how well things could be done. And I had certain frustrations about some of the limitations in private practice I was faced with over here, which is why I went on to open a clinic, and I could be much more in control of how I wanted to offer my services to my patients. I really wanted to deliver absolutely first-class service whenever possible and really give them an experience better than I felt I could give if I was within the confines of a different corporate structure.
Yeah. And tell us a little bit about Purity Bridge. I've never been there, but I'm looking forward to my invite.
It's an open invite. So I opened alongside my NHS practice back in 2013. And we've gradually evolved, moved to a different premises now, still in Tunbridge Wells. We're a setup, we've got 3 consulting rooms, we've got local anaesthetic operating facilities. I do my main general anaesthetic procedures in one of the local private hospitals. But we do lots of non-surgical here. We have laser for resurfacing, IPL for pigment treatment. We've got the facilities to perform a wide range of things. So everything from upper blepharoplasty, eyelid lift, through to some local anaesthetic facelift. A lot of lip lifts. I did quite a few upper lip lifts. People seem to travel quite far to see me for those, which is
very nice.
Marc,
they're quite unusual operations, aren't they? And I think you are one of the only people that really focuses on them. So can you explain exactly what you do?
Yeah, it's a really interesting operation. Most people think of lip treatment by using filler injections to try and plump out the lips. But one of the things in some people filler doesn't quite manage to do is increase the vertical height of the pink lip. And what's challenging with filler is to reduce a lengthening white or skin color nose to mouth distance. So a lip lift, by removing carefully a section of skin under here, releasing the tissues and stitching it in a very secure way to the deep, solid, soft tissues can both reduce that nose to mouth distance, it can increase the vertical lip height, and it can evert the lip. So it can give a very nice rejuvenated appearance. So it's really something either for an aging lip or for someone who just has developed either a thin upper lip or an overly long nose to mouth distance. And if it's done well, and if the tension is taken on the deep tissues, and like in all plastic surgery, we don't want the skin to be used to take tension because that creates bad scars. If we do that well, then the scar is really good. It's an almost imperceptible scar that just sits in that crease, that very distinct crease between nasal skin and upper lip skin. So it just sits in that fold there.
It's basically to shorten an elongated upper lip, isn't it?
Yeah.
And it's still the bullhorn technique, they used to call it.
Well, it's certainly been modified since then. So that's a classic technique described by Oscar Ramirez, wasn't it, some sort of 15, 20 years ago. But one of the things that you notice when you're doing the bullhorn technique, which is a technique, and the scar pattern looks like bullhorns, hence the name, but the pattern goes into the nostrils, which is a nice idea because it sounds nice for hiding the scar in the nostril. But what it does do, unfortunately, is it does give a slightly unnatural blunting of the natural creases and borders of the base of the nose, so the nasal sill. So I've found by using modified techniques, which I've adopted from other surgeons, by placing the scar slightly differently, I think we get slightly more natural results with a less conspicuous scar.
Yeah.
So, yeah.
And Alison Telfer is a good friend of mine. She's an aesthetic nurse, runs clinics. Do you know Alison?
I know of her.
Mark? You know of her, yeah. She's just written that
Adrian, you just froze for a
operated
second.
on a patient of hers with great results. And Alison wrote
nice
that you've done some surgery on the patient of her with great results.
Fantastic. That's good feedback. Excellent.
And I know you also are very keen on facelifts.
Yes.
Can you talk a little bit about those, Mark?
Yeah, I really enjoy facelifts. I think they can be life-changing, like a lot of the plastic surgery that we do. My approach is certainly, I always want to do a technique and use an approach that's going to give the best possible result for that patient. And I often use the analogy of buyer's remorse when I talk to patients. So if someone goes out to buy a car or an appliance, 6 months later, they may have forgotten the pain of the cost of it or the buying process, but they're left with what they're left with, and they want to be happy with that. So I always want my patients to be as happy as possible with their results, not only short term, but down the track. Therefore, I think it's really important to choose the best procedure, the most appropriate technique for that patient, which sometimes is more than they have realized. I'll give you an example. If someone's coming in and is unhappy about their lat neck, their turkey neck, the bands, those sorts of things, if we don't specifically address the bands, we don't use often an anterior approach with the scar under here, I think there is a higher recurrence risk of that laxity to the neck. So it's not necessarily what that person expected when they came to see me, but I try and show them a lot of before and after examples of making the right decision. In fact, I gave a presentation at a conference on decision making, making the right decision and wrong decision in facelifting surgery on exactly this topic, because it's very well saying something maybe, I don't know, I can do it quickly, or I can do it mini, or you'll be recovered very quickly. That's all well and good, but if 6 months later the person hasn't got a great result, has still undergone a surgical procedure with all the inherent risks, I think it's really shown to be a poor decision and a poor outcome.
Yeah, and I know you're doing a lot of virtual consultations, Mark, now. Can you talk a little bit about that?
Yeah, it's interesting, isn't it? We're all in these slightly surreal times at the moment, and we're all adapting and adopting technology that wasn't mainstream until now. So I do a lot of virtual consultations. In fact, most mornings during lockdown now, I'm speaking to patients, both new patients and old past patients. I do it through a secure encrypted platform to minimize the risk of being hacked. And I don't treat them. I know some colleagues are using them more as chats with patients informally. I actually go through things very formally and spend a lot of time with patients, because there's an amazing amount of depth you can go into if it's structured, I think, and done in the right way, to the extent that I'm having 2 consultations virtually online with new patients with a plan to see them in person after lockdown. And I'm hoping with the depth of what we've gone through between now and then, it will almost be a formality, just examining them, getting precise measurements, checking what I haven't been able to glean from photographs and discussions. But they've been interesting. And I do think we chatted before about this. I think they will be here to stay. I think it's becoming a very interesting concept to go through detail in that sort of way prior to an in-person consultation, because it's a big step, isn't it, coming to see us?
Yes, absolutely.
It's a smaller step, doing what we're doing now, chatting virtually, effectively. And I think that will help a lot of people dip their toe in the water to decide whether or not they would like to take it further and take that step.
Yeah, I think you're absolutely right. And where should you be now, Mark?
Where, in terms of where in the world should I be now?
Yeah.
Well, it's a good question, because I've, like all of us, travel's been profoundly affected, and I had many conferences scheduled to be speaking at during the year. And actually, funnily enough, I think it was going to be Spain at the moment. I should have been in Germany a couple of weeks ago. And then next month, it would have been Stockholm.
Yeah. And tell me about the operating, when you do operating in front of an audience.
Yeah, well, so in Stockholm, it was a great conference, Beauty Through Science, which is an annual fixture, which is a big deal. It would have been my first live video operating experience. I certainly have had a number of regular groups of surgeons come to visit me. It's great bringing people to the small town of Tunbridge Wells from abroad. I've had groups of surgeons from Italy, from the Middle East. I've had quite a wide range of nationalities come to watch me operate, and to have some interactive lectures and discussions. And there's nothing that keeps a surgeon on his toes than like having 5 or 6 colleagues and peers watching.
Yeah. And Mark, we're just losing reception a bit here. I'm not sure whose side it is. Maybe it's me, maybe it's you.
Okay, well,
can you hear me okay,
move
Mark?
to a different location. Yeah, I can hear you perfectly.
Yeah. Oh, it might be me. So, but just carry on. It's a bit better now. So, Mark, when you operate live, there's a video link to a big room of people watching you, isn't there?
That's right. So you've either got the experience of having a small group of surgeons in with you in theatre, which is, as I was saying, a little bit, it puts quite a lot of pressure on in a way, because they're talking to you, giving their opinions all the time. And I've certainly had some surgeons not being shy about, why are you doing it like that? Why don't you do it like that? Which is great, because it makes you think as a surgeon all the time. But otherwise, for a conference, you're right. It's a video link, so you're mic'd up. You've got a cameraman there, and you've got questions being relayed through from the audience in the main lecture theatre.
Is it a bit stressful, I would imagine?
Yeah, but it's. I think these sorts of things, doing these sorts of things, and lecturing and showing your results and your techniques as a surgeon is probably the best clinical governance we can do. It really is one of the best things we can do to keep ensuring we're doing our best for our patients, keeping at the top of our game, making sure that we are minimizing risk and optimizing outcomes. So I think it's something we should all be doing in some form, perhaps.
Yeah, I absolutely agree. It was like an audit. So, Mark, that time's gone really quickly. If anyone would like a virtual consultation with you, how do they go about doing it?
The easiest thing is to drop an email, or you can contact me via Instagram, actually. So I get a lot of people getting in contact, so I'm sure you do too, via Instagram. Our email is info@puritybridge.co.uk. So info, like information, at puritybridge.co.uk. And there's a process, and one of the team in my virtual office, I should say, will be able to organise that.
Brilliant. Well, lovely to talk to you again. We haven't even touched on your facelift techniques or your breast techniques, so perhaps we could do that again.
Absolutely. Pleasure to speak to you.
Yeah, lovely to speak to you, Mark.
Okay,
see you soon.
take care. Bye.
Bye.